Today on the channel, we're going to be talking about habits that are secretly aging your skin. The last one is something that I see people do even when they have the best facial skincare routine. We're going to dive into the list, and I want you to let me know down in the comments if you are guilty of any of these things. Tip number one may not come as a surprise to you, but that is skipping sunscreen on cloudy or rainy days. Every day we're exposed to ultraviolet light, and ultraviolet light is beyond the visible spectrum, meaning you can't see it. So it's deceptive when you go out on a cloudy or rainy day, or even just through the winter, because you think that you're not getting a ton of sun, but the ultraviolet rays can still be very intense. If you are into habits like skiing or hiking, it doesn't have to be really bright and sunny, and you can get a sunburn. Up to 90% of the skin's aging is caused by ultraviolet rays. And you might think that you're safe if you're working indoors and you don't go outside a lot. I've taken off so many skin cancers from people who tell me, I don't go outside anymore, doc. Well, UVA, which is the aging type of ultraviolet rays, comes through window glass. So if you work in an office near a window, or if you're driving a lot, that side glass on your car does not prevent UVA rays from reaching your skin. So I recommend to my patients that you get in the habit every day of wearing sunscreen. SPF 30 is the minimum recommendation from dermatologists in the American Academy of Dermatology. If you put on an SPF 30 every day before you leave your house or you start work, even if you're working from home, you are going to be protecting your skin and avoiding those things that will make you look older faster. One other reason I recommend just being in the habit of sunscreen every day is that we get caught off guard all the time. You think you're running out for a quick errand, and maybe you get caught talking to somebody you didn't expect to run into. You spent another 15 to 20 minutes outside, and now you're a little pink. You've gotten a little burn, and you weren't protecting yourself. If you're in the habit of sunscreen daily, you're not going to get caught off guard no matter what the scenario is. The second habit that's making you look older faster is using too many exfoliating ingredients. And this can be physical scrubs or chemical exfoliants when you're overusing them. Let's start with the physical scrubs. The classic is going to be St. Ives apricot scrub, and we all have probably used this when we were younger. I know it was a staple of my teenage skincare routine, trying to scrub away that acne. And most of you have probably used it too. But when you use these harsh abrasive scrubs, they do break down your skin barrier, and they cause micro tears in the skin. That damage to the barrier leads to inflammation, and that is unfriendly to your collagen and your elastin. It's going to put you at increased risk of developing rosacea and skin barrier problems, more likely to become allergic or sensitive to ingredients, even if you've been using the same products for years. When it comes to the chemical exfoliators, these are things that at low percentages are generally pretty safe to use 1 to 2 times a week. But if you're getting in the habit of using them almost daily, it's really too much exfoliation for your skin. And once again, you're going to be thinning out your skin barrier. You're going to increase your risk of sensitivity and allergy to different ingredients in your skincare. You're going to be more likely to become allergic to fragrance or other things that you're exposed to at work. And all of these things, when it leads to inflammation in the skin, will eventually be damaging your collagen, your elastin. It's going to make it harder for your skin barrier to resolve and improve itself. So when it comes to exfoliation, you do want to keep it simple. It's not something that you need to be doing every night. Some people like the skin cycling idea, where you're using retinol some nights of the week, and then maybe you're using a glycolic or a salicylic acid 1 or 2 nights a week. And I generally like that approach a little bit better, but don't go taking on those exfoliators several days a week. The third habit is something that I see people making, especially when they have more oily skin types, and that is neglecting moisturizer, especially at nighttime. Your skin has a robust moisture barrier, but it's under assault all of the time, and most of the skin disorders that we treat in the clinic have some variation of barrier dysfunction associated with them. Yes, acne has barrier dysfunction. Rosacea definitely has barrier dysfunction. And when you're starting to get lines and wrinkles and pigmentation, these all come along with their own degree of barrier dysfunction. So if you're missing a moisturizer at night, you're not putting back on those essential lipids. It's even more important if you're at very dry climates. I practice in Idaho, and my patients that have moved from California or from Florida or from other humid environments complain about the dry air, and their skin gets so dry, and in the winter it's even worse. So it becomes incredibly important to use a moisturizer. Now, I generally recommend that you use fragrance-free moisturizer moisturizers. You can use thicker creams, things like CeraVe cream. You can use lighter gel moisturizers like the Neutrogena Hydro Boost Water Gel. These all have ingredients like hyaluronic acid, ceramides, glycerin, things that are going to lock moisture in the skin and actually put some moisture back into your skin. So you're not just using them as an occlusive, you have some of the humectant properties. I'll link a couple of my favorite moisturizers down in the video description. But using a moisturizer consistently is good for your skin no matter what your skin type is. Just find one that works well in your skincare routine and use it consistently. Number 4 is something I can say that I am not guilty of personally, but I've had many people confess to me that they will occasionally sleep in their makeup. If you are out for the evening and you're coming home and you're super tired, it is so important to wash your face before you go to bed. Even if you don't plan on doing an entire skincare routine, try to get that makeup off because you have now produced more oil on the skin, sweat, you've been exposed to dirt and maybe environmental toxins and pollutions, and all of those things will take a toll on your skin. And if you don't wash off your makeup, it's just getting trapped underneath that makeup, and those pollutants and toxins will get into the skin and can lead to damage of the proteins in your skin, damage of the collagen and the elastin, and that inflammation that happens as a result is going to age you faster. You might think it's innocent to just skip washing your face, but if you're doing this 2-3 times a month, I promise it's gonna add up and it's gonna age you faster. So always wash your face before you go to bed. Again, lots of good cleanser recommendations, so I'll leave a few of those down in the video description. And if you're really in a pinch, a makeup removing wipe is good enough before you crash and go to bed for the evening. So Neutrogena makes some great makeup removing wipes, and I'll have a link to those down in the video description for you. Number 5 is using too many active ingredients at once. We have this idea, maybe it's just an American thing, that a little bit is good, so a lot must be better. And so we get in this habit or this idea of using a retinol and a salicylic acid and a glycolic acid, and we start doing 2 or 3 things that are active ingredients in our skincare routine in a day. And some people will even do more. You don't have to layer on 10 different products in order to get good skin. By and large, your skin is great at regulating itself and doesn't need help in every single category. I personally keep my skincare routine very simple. In the morning, I wash my face, I put on a vitamin C, and I put on a moisturizing sunscreen before I go out the door. At nighttime, I wash my face again. Once it's dry, I put on a retinol. I usually use the Skin Better Alpha Ret. It does have a little lactic and glycolic acid in it as well at low concentrations, so I'm not over exfoliating. It's a multi-purpose product, but I'm not doing multiple steps. After the retinol, I put on a moisturizer and I go to bed. By and large, that is what I do. Unless I'm testing out some other product to do a video review on it, I might choose an eye cream, I might try something else, but usually I'm just working in different types of moisturizers, cleansers, and retinol into my routine because that is the bulk of what I do consistently. If you are doing 10-step skincare routines, it's likely that you're putting on too many active ingredients. So what's happening then? You're creating inflammation. You're increasing your risk of sensitivity and allergy on the skin. And again, it's that cycle where you have inflammation, sensitivities, you're more likely to see degradation of your collagen, the increase in the development of fine lines and wrinkles, you're putting yourself at risk for more pigmentation, inflammation, rosacea, redness. All of these things are not good for you. They're gonna make you look older, so avoid using too many active ingredients in your daily skincare routine. And number 6, and the last thing that I see people do, even if they don't break any of the rules that we've talked about before, and that is neglecting the neck, chest, and the hands. I can't tell you how many people I've seen who have flawless skin, even into their 60s, 70s, but their hands are telling their age, or their neck and their chest is telling their age. The skincare that you use on your face can be taken down onto these other areas. So when you're using your retinol, you can take that down onto the neck and then moisturize afterwards. Your vitamin C can come on there. You can get vitamin C on the back of your hands. And of course, probably the most important thing that you can be doing when you put that sunscreen on your face in the morning, take it down onto the hands, onto the neck, and onto the chest, especially if you're wearing something that's low cut. Because your face may not be telling your age, but the other things will. I've seen patients come in, their facial skin looks amazing, but they're really frustrated with the way that their hands look. And so we're doing laser treatments on the hands or the neck or the chest to try to rejuvenate that skin and help them look as young in those areas as they do on the face. So that is something that even the best people with their skincare often neglect, is the neck, chest, and the hands. If you're guilty of any of these habits that are secretly making you look older, don't fret about it. Awareness is the first step, and you can start to change your habits now. Make sure that you're washing your face, using a moisturizer, not sleeping in your makeup. Don't neglect your skincare on some of the other areas that are frequently exposed. But if you are guilty of any of this, hit the like button. Let me know what you've been doing down in the comments. And if you subscribe to the channel, you're gonna see more videos that are gonna help you to correct these things, help keep you looking younger throughout your life. And also, we're gonna be talking about how to stay healthy on the inside as well, because the things you put in your body, the way that you have physical activity and exercise, all manifests on the skin. I want you to look and feel radiant inside and outside, and that's what we try to do here on the channel. So I will see you guys on the next video.